Good morning, here, dear students. Today we will talk about pneumonia in children, etiology, diagnosis, and treatment tactics. I am a PhD assistant of Department of Pediatrics and Neonatology, Karjavava, Ulnoza Lukasevna. So, we will discuss today common causes of pneumonia in children, various ages, classification, clinical manifestations of pneumonia, and we'll select appropriate antibiotic therapy for child with pneumonia. So childhood pneumonia remains an important cause of morbidity and mortality in developing world. 4 billion deaths annually in the developing countries. About 20% of all these deaths in children under 5 years are due to acute lower respiratory infections. 90% of these deaths are due to pneumonia. Early recognition and prompt treatment of pneumonia is life-saving. Low birth weight, malnourished, and non-breastfed children and those living in overcrowded countries are higher risk of getting pneumonia. These children are also at a higher risk of death from pneumonia. About 1/2 of all children at 5 years old with commonly acquired pneumonia will require hospitalization. So let's give definition. What's pneumonia? Pneumonia is an acute infectious inflammatory disease of various nature with involving of lower respiratory tract interpathologic process and intraalveolar inflammation exudate. So possible etiologic agents, we have bacterial Streptococcus pneumonia, an atypical one. Atypical, it is Mycoplasma, chlamydia, and viral pneumonia. It's RS virus, respiratory syncytial viruses, in children younger than 2 years. Viral infections were found in 18 of children with pneumonia. In older than 5 years, viral infections were dedicated only 37 of the time. Next cause, it's large group aspiration pneumonia. Next large causes depends on patient's age, it is immune status, location. For example, children under 6 months old or with their background conditions, these are rickets, hypertrophy, and some anemia with a less immune system disorders. Pathway. And pathway, microorganisms often follow upper respiratory tract infection. So it will cause the lower respiratory tract invaded by bacteria, by viruses, or other pathogen. So next, preceding viral illness leads to increased incidence of pneumococcal pneumonia. Next, immune response leads to inflammation. Next, lung compliance is decreased. Small airway become obstructed air space collapse progress. It will lead to ventilation perfusion mismatch and decreased diffusion capacity leading to hypoxemia. We have some types of pneumonia. So classification, it's bronchopneumonia. Pneumonia due to bronchial wall or bronchial infection, viral. Most cases it is viral or after airway infection. Lobar pneumonia, it is bacterial. One or two lobe will be destroyed. Interstitial pneumonia, Interstitial pneumonia has inflammation among vessel walls and alveolar membrane. Congenital pneumonia, it's from birth, yes, pneumonia from birth time. Community-acquired pneumonia. Community-acquired pneumonia being at hospital 48 and 72 hours. It's pneumonia. Nosocomial pneumonia. Nosocomial pneumonia, after discharging from hospitalization during 72 hours, if children get pneumonia from hospital, it becomes hospital-acquired pneumonia. Next, aspiration pneumonia, aspiration vomiting mass, aspiration with food, aspiration with the stomach juice, yeah, and aspiration, blood maybe, pus, and etc. Next, non-complicated pneumonia and complicated pneumonia. Complications of pneumonia, it's we will divide pulmonary and extrapulmonary. Pulmonary leads part of pneumonic effusions and emphysema, pneumothorax, intraalveolar scarring. Yeah, extrapulmonary infective endocarditis, cerebral abscess, meningitis, septic arthritis, infectious toxic shock, and disseminated intravascular coagulation syndrome. What is serious? It is a sequelated lung abscess with X-ray sample. So, signs for neonatal pneumonia. Neonatal pneumonia, younger than 2 to 6 months, low parenteral education, smoking at home, prematurity, varying from breast milk at it's 6 months, anemia and malnutrition. It's causes for risky factors for or causes for being congenital pneumonia. There is some samples with clinical symptoms of congenital pneumonia, some clinical case. So physical examination of this baby was X-ray infiltrates of lung tissue. It is, as you see, it is lobar pneumonia, right lungs, upper lobar pneumonia. Congenital pneumonia, clinical symptoms, tachypnea, irregular respiratory movements, apnea, flaring of LA nostril, grunting involving chest muscles, temperature may be present in some babies. Poor feeding, lethargy or irritability, temperature, instability, poor color, cyanosis, abdominal distension, and tachycardia. Congenital pneumonia, late onset of congenital pneumonia after 7 and 14 days of life, mainly chlamydia or urea mycoplasma. While getting birth, these babies have a high risk to swallow, yes, maternal, vaginal consent. That's why the most important, most etiologic agents, it's chlamydia or mycoplasma. Onset, it's usually preceded by upper respiratory tract symptoms and conjunctivitis, non-productive. Cough, fever is absent, afebrile temperature, pneumonia syndrome. Afebrile pneumonia syndrome, what does it mean? In neonates have a less immune response because not yet they have a differentiated immune response, immune system yet. That's why they have maybe no temperature, but cough and rales. Signs such as dullness of percussion, change in birth sounds, and presence of rales or bronchi are virtually appreciated in a neonate. Weakened breathing during auscultation, moist bubbly sounds, crepitating, respiratory failure develops gradually. Viral pneumonia, respiratory syncytial virus, such as the parainfluenza, adenovirus, enterovirus. Clinical features with several days of rhinitis, cough, following by fever, more pronounced respiratory tract symptoms such as dyspnea, intercostal retraction. Late findings, its preponderance of lymphocytes observed on CBC, diffuse or bilateral infiltrates visible on chest radiograph, rapid test for viral antigen culturing nasopharyngeal specimens of viruses. Viral pneumonia X-ray samples. So, symptoms of signs will divide for 5 categories. Non-specific and toxicity, signs of lower respiratory disease, signs of pneumonia, sign of pleural effusion, and pulmonary disease. Treatment. Supportive care for children, oxygen if needed, fluids and ensure hydration, antipyretics, analgesics, sputum dilation, and normalize intestinal microflora. Treatment. Antibiotic treatment, it is beta-lactams, penicillins, cephalosporins, carbapenems, aminoglycosides, macrolides, lincosamine, lincomycin, clindamycin, and last, vancomycin. Bacterial, we will treat with ampicillin, cefuroxime, with a leading dose, and benzyl penicillin. Supportive care for atypical pneumonia. In case of atypical pneumonia, chlamydia or mycoplasma will begin with erythromycin or cotrimoxazole. It's combined, yes, antibiotics with a combined character intravenous. So, in summary, what should I say? Fast breathing in a children with cough or difficulty breathing is highly sensitive or specific for diagnosis. Fast breathing with respiratory failure with cyanosis, it will be sensitive for every doctor. Tachypnea is the most useful physical sign. Most children can be treated as old patients who have no background conditions, and therapy should be guided by probably etiology and severity of disease. You should begin treatment with antibiotic pneumonia with probably knowing etiologic agent of this disease. It will be, in most cases, different. That's why you should treat every patient individually, yes, strict individually. That's all. Thank you for your attention. Be healthy.